On today's podcast, we will be speaking to Dr. Riken Patel, who started out his career in the medical field specializing in orthopedics, gastroenterology, and pain management. Riken left the medical field to pursue entrepreneurship outside of medicine. He co-founded a company, Ride Clean, which was later acquired in 2018 by Cox Automotive. Now, Riken identifies as a doctorpreneur, a term that he will explain during the interview. One of the topics that we'll be touching on today is burnout. I'll probably do a complete separate podcast on it because I think it's so relevant. But doctors especially face tremendous burnout. Dr. Riken will touch on this from his perspective. But to give you some insight, the National Academy of Sciences had done a report back in October of 2019 and found that between 35 to 54% of nurses and doctors experience burnout. And that number is 60% for medical students and residents. Now, these figures are before COVID and the pandemic's impact on the healthcare system and their personnel. In the case of medical professionals, the symptoms for burnout were emotional exhaustion, loss of enthusiasm, lack of joy and passion in the work, and detachment from patients and their ailments. Depression and suicide are commonly linked to burnout. Physicians have twice the rate of suicide than the general population. And much of the burnout stems from large workloads, long hours, and a broken healthcare system. I once heard some extremely helpful advice on burnout from a business coach. When we have a laundry list of tasks, we tend to look at how much work must be done, and then we feel overwhelmed at the amount that's on that list. Burnout happens from feeling anxiety when looking at that mountain that has to be climbed versus being in the weeds doing the work. Now, the advice to counter burnout was to structure your day with a few high-level tasks. Mentally, knowing that there are only a few things to do and not 100 things reduces anxiety and improves motivation. Now, if I can take that analogy to doctors, that laundry list keeps growing. That mountaintop can't be seen. And doctors don't necessarily have the option to reduce their tasks for the day. So you can understand why burnout is so prevalent in the medical field. It's a conversation that needs to happen, and I'm extremely excited to discuss it more with our next guest. Riken, I'd like to welcome you to the Business 360 podcast.
Thanks, Rishabh. Great to be here.
Absolutely. So happy to have you. So I'm just going to get right to it. Let's start with why you left your medical practice and pursued entrepreneurship outside of the medical field.
I mean, it was burnout. I mean, to be honest, just realizing where I was in my clinical practice, the day-to-day grind, and that it wasn't my passion anymore, that I lost the passion for it. And when I came to that realization, and then I was presented with an opportunity, you have a window of opportunity, and if you don't jump through that window, sometimes that opportunity will close. And then you have to see if another opportunity opens up. And so I think for me, I was at that perfect crossroad of realizing where I was and what was weighing on me, what I wanted to do, why I wanted to do it. And then the opportunity came. And then when the opportunity came, you either seize that opportunity or it passes you by. And I took a big leap at that point to seize the opportunity and to go for it.
So let's talk about burnout. Burnout is common for most professionals, but it seems to be most prevalent with doctors. So in your opinion, why do you think that is?
I think when most people become doctors, they do become a physician out of the connection of a doctor-patient relationship, to really care and get to know an individual and then help them towards a healing outcome. And in my opinion, what happened is that the system took over. So physicians began to lose the autonomy, and the systems began to direct what they did, whether it was an insurance payer, hospital systems, administrations, and we weren't able to sort of create the relationships that we wanted with patients. And then we got buried in the EHR systems and paperwork and things that were really outside of what was most important to medicine, which was interacting with the people we were trying to take care of. And that extra work, like Rishabh, sometimes doctors report doing 3 to 4 hours of paperwork per day, and if you look at your time, where does that time go? It has to come from somewhere. Either it comes from taking it away from the patient, right, when you're in the room with the patient, or it comes at the end of the day, so you're taking it away from your family, or maybe it's at night when everybody's asleep, and then it takes away from yourself. So these factors and these pressures that occur as a result of the system of healthcare we've created is I think what's contributing to doctors burnout the most.
So for those that may be feeling the way you did, which is burnt out, whether they're doctors or just other professionals, what advice would you provide to counter that? Because I think it's an important topic when we're thinking about mental health these days.
I think you really have to do some internal searching. You really have to start focusing on yourself first. I think for me, it was deciding, why did I get into clinical medicine? What are my real goals in life? What am I truly passionate about? And for me, I felt medicine had taken away some of the creativity that was so important to me feeling passionate about things and working on things. So when I got deep to the why of like, I think I want to impact the lives of others, but I don't think the traditional clinical healthcare model is the way I want to do it. I realized that I needed to start to separate myself. And then once you get to that core, I think a lot of times you need to talk to people. Some people get scared by the word of therapy, right? But I've been in therapy personally, both personally and professionally. I've done growth things, and then I've had mentors and people along the way. So once you get to that why, and sometimes the why is I want to stay in clinical medicine. I enjoy taking care of patients, but how do I need to adjust my lifestyle, my work-life balance, or the work situation I'm in so I feel more fulfilled and balanced? Like you have to start to seek out those things. So one, you can start by doing a vision exercise, right? Like really map out what you're doing, where your time is going. Is it worth it to you? Why are you doing those things? And then it's starting to come up with sort of doing some personal growth and figuring out, sometimes it's a drastic change moment. Like you got to put a stake in the ground and burn boats and move on. And other times it's like, you know what? I'm going to do this gradually over time, but you take some sort of action towards that goal. Because I think a lot of us as physicians think about it, but we struggle because how could we possibly leave all that we know? And what I learned along this journey was that we know a lot more than what we think we know. We think we can only practice in this certain clinical realm of specialty, when our training has given us the tools to apply ourselves across anything we want to apply ourselves to. And that really comes by doing some internal reflection.